Most owners leave the vet feeling like they did something wrong. Not because the vet said so directly, but because the conversation surfaced something they had been doing, or not doing, that landed differently once a professional said it out loud. The guilt is real, and it is almost always accompanied by the same thought: I did not know. Nobody told me. This is the telling. 6 things, not rare, not edge cases, common practices in ordinary households with love dogs, that create problems significant enough that the people who see their consequences professionally wish owners would stop. Not judgment, information. The kind that arrives before the appointment rather than during it. The first is skipping dental care because the dog does not seem bothered. She does not seem bothered because dogs do not show dental pain the way humans do. The same biology that masks other pain. The evolutionary imperative toward appearing functional regardless of what is being managed internally applies to the mouth with particular effectiveness. A dog with significant dental disease will eat, play, greet you at the door, and pass every behavioral test of being fine that owners typically apply, while carrying infection and pain that has been building for years without visible complaint. Dental disease is one of the most common conditions seen in domestic dogs, with the majority of dogs over the age of 3 showing some degree of periodontal disease. It is not only a mouth problem. Oral bacteria entering the bloodstream affects the heart, the kidneys, the liver, organs whose compromise is slow, cumulative, and entirely non-dramatic until it is serious. The absence of complaint is not the absence of the problem. It is the dog doing what dogs do, which is carry the problem quietly. Dental care, regular teeth brushing, appropriate dental chews, professional cleaning when recommended, is not optional maintenance. It is disease prevention in one of the areas most likely to produce silent damage. The second is waiting too long to go to the vet because you do not want to seem like an anxious owner. The concern about being seen as an anxious owner, the worry that bringing in a dog for something small will mark you as the person who overreacts, silences more legitimate health concerns than almost any other single factor. And in the specific context of dogs, who do not show illness until it is advanced, waiting until the concern is undeniable, has a clinical cost that early presentation would not have carried. Behavioral and physiological changes that owners hesitate to bring forward. The subtle shift in energy, the slight change in gait, the small reduction in appetite that has persisted for 2 weeks are exactly the kind of early signal that, investigated promptly, allows intervention before the underlying process has progressed. Waiting until the signal is impossible to dismiss is waiting until the process has had time to establish itself. There is no such thing as going to the vet too soon with a legitimate concern. There is only going too late. The third is feeding table scraps without understanding what is toxic. This is the piece most owners miss entirely. The list of foods that are genuinely toxic to dogs is longer than most owners know, and several items on it are foods that appear in ordinary human meals with enough regularity that the exposure risk is real. Grapes and raisins, in amounts that would seem trivial, can cause acute kidney failure in dogs with a mechanism that is not fully understood and a sensitivity that varies between individuals without warning. Onions and garlic across all forms, including cooked and powdered, damage red blood cells cumulatively with repeated exposure. Xylitol, the sweetener present in an increasing range of products including some peanut butters, sugar-free gum, and certain baked goods, produces a rapid insulin release in dogs that can be life-threatening at low doses. The generosity that produces the table scrap is real. The risk is also real. Knowing which foods carry it is not paranoia. It is the specific, practical knowledge that allows the generosity to continue safely. The fourth is using flea and tick prevention inconsistently. The owner who treats in summer and stops in autumn because the visible presence of insects has reduced is operating on a seasonal model that does not match the actual risk calendar. Ticks in particular remain active at temperatures significantly lower than most owners assume, in many climates down to near freezing, with activity resuming on warmer winter days before the spring arrival that owners are typically watching for. The diseases carried by ticks and the consequences of late or missed diagnosis are sufficiently serious that consistent year-round prevention is the standard recommendation. Not seasonal prevention, consistent prevention. The months when the risk feels lower are often the months when the prevention has been stopped. And the gap between perceived low risk and actual continued risk is where exposure happens. The fifth is misreading weight. The majority of dogs seen in veterinary practice are overweight. Not dramatically, not in the way that is impossible to miss, in the way that accumulates so gradually in a dog you see every day that the baseline shifts without the shift being registered. The dog who was at a healthy weight a year ago and has gained 2 kilograms is not a dog who looks dramatically different. She looks like your dog. The clinical consequences of excess weight in dogs are not minor. Joint stress, reduced organ function, shortened lifespan, increased surgical risk. the compounding of almost every other health condition she may develop. All are meaningfully worsened by carrying weight beyond her healthy range. The assessment that matters is not whether she looks heavy. It is whether you can feel her ribs with light pressure without pressing through a layer of fat, and whether she has a visible waist when viewed from above. These are the two assessments your vet is running. They can be run at home with honest hands before the appointment that would otherwise have delivered the finding as a surprise. The sixth, and the one with the longest reach, is not knowing her normal well enough to recognize her abnormal. Every dog has a specific baseline. The precise pattern of her eating, drinking, sleeping, moving, eliminating, engaging. The particular way she carries herself through an ordinary day in her ordinary health. The owner who knows that baseline, who has paid enough attention across enough ordinary days to have internalized what normal looks like for this specific dog, is the owner who notices the deviation, who catches the 3-day reduction in water intake before it becomes significant dehydration, who notices the change in gait before it becomes a limp, who registers the quality of the stool change before it becomes a week-long digestive problem. Behavioral observation of dogs whose owners were trained to monitor and report baseline deviations showed significantly earlier presentation of health issues compared to owners who relied on visible symptom thresholds. The baseline is the diagnostic tool. Knowing it is the earliest intervention available to you, one that requires no training, no equipment, nothing except the specific, continuous, honest attention you are already in a position to give. None of these require a different owner. They require a more informed one who has closed the specific gaps between loving their dog and understanding what caring for her at the level she deserves actually looks like. She cannot tell you her teeth hurt. She will not stop eating to show you she is in pain. She will not lose her appetite dramatically until the process has been running long enough to make dramatic responses inevitable. What she has is you, the person who sees her every day, who knows her in the way that only daily proximity allows, who is, in the absence of her ability to advocate for herself, her primary advocate. Be that accurately, not perfectly, accurately. She has been trusting you with her health since the day she arrived. Now you know a little more about what that trust requires. Which of the 6 felt most like something worth changing in your own household? And has there been a moment where catching something early made a real difference for your dog? Tell me in the comments. And please, if anything on this list surfaced a concern about your dog's health right now, call your vet, not tomorrow. Today. If this is the kind of watching you want to keep doing, subscribing means the next one finds you.